Hi, welcome to everyone. We have a panelist also. I'm Dr. Sanjana. I'm a diabetologist by qualification and lead of medical affairs at Eka Care. I would first like to welcome back all the doctors who have been attending our monthly webinars consistently for the past few months. And for those who registered with us for the first time, a warmest welcome to all of you to the Eka Doctor community. So every month we have made it a tradition where we conduct webinars which will get doctors to understand a little more on the perks and advantages of going digital, and certain things unlock opportunities for the practicing doctors in general. So our last webinar was about revenue opportunities for doctors, where we predominantly spoke about DHIS and another novel concept which we'll be discussing. So the previous webinar, we found a lot of doctors very interested in the DHIS, and we could not focus on the other opportunities that we wanted to convey to the doctors, and hence today our webinar is going to focus a lot on obviously unlocking opportunities for earnings for us doctors, how to start pharmacies and labs with a zero cost. So just to set in a little context, so as every doctor here in the audience can relate, so when we set up our private practice, we want our clinic to be the one-stop solution for every patient or their family's health and wellness. And due to logistic reasons or financial reasons, it always is not the case. And in today's webinar, we have like the industry experts to give us their knowledge and experience around it, and even discuss some of the solutions that we as Eka Care have come up with. So before we start the webinar, just a few things. First, like at the end of this webinar, we'll have a live demo. So I need all the doctors who would be interested. At the end of all the talks by our panelists, we will have a demo for you to understand our EMR. And we will just be running a few poll questions in between. So feel free to give us your, honest experiences and answers, which will help us address and engage with you better. So we will first start our talk with our very own Deepak Tuli sir. He is our first speaker for the day. He's the co-founder and CEO at Eka Care with more than like 17 years of experience in building successful businesses. He has been the CBO and co-founder at GoIBO and built it from scratch. And he's already made his mark in the travel industry. And he's been revolutionizing healthcare industry for the past 4 years. So welcome, Deepak sir, and thank you for taking out your time. Over to you.
Thank you, Dr. Sanjana. I hope I'm audible. And I love this topic, early opportunity. I think earning opportunities, pardon my misspell. So I love this area because that's what I've been doing throughout my life. How to make money is my passion for companies, and hopefully we'll be able to guide and give my experiences how it will work. And then I have my team members who would probably go in details. And first of all, I'm like surprised to see number of participants. When we moved from Go to Eka Care, really health, meeting doctors was one of our biggest challenge. Getting into doctors' clinic, meeting doctors and taking out time was the biggest challenge. There were very, very learnings. I'll share some of my learnings and how we learn from those learnings and build systems which are really helpful for our doctors. And hopefully we are adding value to the doctors. There are a lot of them on our platform. A lot of them I speak to them personally, and people are appreciating the efforts where we are adding value into daily practice. And when you add into someone's daily practice, it makes a lot of difference. I think that's called behavior. When something happens to me regularly, every day, that's when it really impacts my life. And as doctors, you've been treating your patients every day. If we can add value into any one of them, you will remember. So a lot of doctors, when I call, they still remember because they use our technology every day, and we are adding some fundamental value. Before that, as Dr. Sanjana said, Vikalp and I built both the founders here. We built GoIBO. GoIBO was the last entrant into travel, and we sold that company, merged with Make My Trip, and it was $1 billion exit. I've been into digital world since the digital world exists in India. I started working at India Times in 2006. That time, there was Yahoo, and there were people buying. Internet was a large entity, and there was no Flipkart, there was no Amazon, there was no Ola, there was no Uber. So from there to now, I've seen this whole evolution of how digital technologies change things. Health travel in every country is the first place where people move from offline world to online, and health is the last. So we have chosen on both end of this shift, where we first chose travel, and now we're choosing the health tech, where we're revolution basically moving this whole transition into digital, and the whole ecosystem is supporting. So today, if you look at whole government ecosystems are supporting digitization after all the industries. Everyone wants the healthcare to be digitized, and it'll really help. Not only the patient, but doctors as well. And doctors are most critical piece into this whole equation. And that the amount of respect I had earlier for doctor, that respect has just increased after joining health care, and I now feel much more respect for doctors, because the way whole ecosystem is structured around medical practice, from education and then doing practice and then doing MD and then doing services, and then come to a life, middle age is when doctors really start making practice and start making money, versus when I look at people around me, an engineer goes to college, pass out, and then start making money, which a doctor will probably start making after 10 years of uh, doing more education than that engineer. Or for a business guy like me, probably spend 2 more years in an MBA and then start making money immediately. But for a doctor, it takes much, much longer. So it's a very, very hard journey in the beginning, and then optimizing things later on is also challenging, right? You're actually not just doing medical practice, you're running like an SME, your own setup, which is very hard for people even after, doing management and after doing engineering. It's hard for people to do everything together. I've seen a lot of people failing in that. And hats off to doctors of managing both medical practice and running their clinics. It's a hard problem. It's a very, very hard problem. Ask me, I have a lot of people where I've seen in offices, even after doing relevant education, it's hard for them to run businesses. So for doctors to do that, this respect just goes, increases, and understand, the inequalities in the whole ecosystem today, where the earning capacity of a doctor is very, very low compared to of a doctor, education and the time invested. So return on capital takes a lot long in the case of a medical practitioner versus other. And that's why, we came up with this whole equation where we wanted to really help, and saying if this return on capital could be faster, or if not faster, how can it be easier, right? The core for a doctor should be treating patient, and if somebody else can take burden for other things, it will be super helpful for doctors. And that's what, all the doctors I now interact with, and I'm on their WhatsApp, really respect, really thanks us for doing that, because it really helps, build the practice uh, far, far, far smarter and easier to do. That's one of the things, really wanted to share out here, is how we are now getting into a little more into how EgaCare is helping these doctors and in building practices together. We have built some solutions around learning from doctors. The first learning I had was that, before us, there were a lot of incumbents who came into the market, started digitizing for doctors, but they built mistrust, which is a big, big problem, where doctors and a certain set of doctors started feeling that the platforms are not working for them or with them, but against them. They're creating competition. That was first learning. We took that learning and we engraved this into our heart. That's our biggest learning in this category. After respecting the doctors, that never create a competition between doctors. Work with the doctor if you have to be very successful in this organization. I firmly believe if doctors are not with us, we will not be able to build a big company or a large company out here. We'll only be able to build a large company if doctors are with us. That's why our every decision, from being taken by me to anyone in the team, is first question we ask: how will this decision impact our trust on doctors? If we start losing the trust, it'll never work. Whether we make money or not make money, if we have, if we lose the trust, one thing is very sure, we'll never make money. But if we have the trust of doctors, the another thing is sure that we'll make money. Not today, tomorrow, maybe day after tomorrow, but we'll definitely make money. So that's like engraved in our hearts. We work really build solutions around how can we build, kind of still earn the trust and take it to the next level. That was the first learning. So fundamentally, if you see whatever we are doing, you will have, kind of things which are, get more trust of the doctor. There are areas where we don't compromise. Similarly, there are areas where we don't compromise is that we have to run a company. We are not a charitable organization, so we have to also make money. So we don't give anything from our pocket. We work like a partner where we take a very small share of whatever we help doctors make money, but we'll take a very small share out of that cut. We will never be able to give from our pocket. That's another fundamental thing. So, it's always good to have fundamental ethics of an organization in place so that we can go long term. Some of the doctors will not like us for doing that. For example, we don't give our EMR for free. We don't burn from our pocket. Some of doctors will not like us today, but we are sure that once they see the honesty of doing the business in the right way, they'll come back to us. A lot of doctors respect us for doing that because there's no free lunches for anyone. There's absolutely no free lunches for anyone. So same thing for us. We also are responsible for our investors. We have raised capital and we have a board to report to. So we were very sure of, how this fundamental plays on both sides, not only on our side that we just don't want to make money and then kill everyone else who comes on our way. We want to partner and take a smaller share. I'm again repeating these words because these are fundamental thoughts. Always take a very small share and we'll pass on the large share like any other service provider. Those are the fundamentals we work on. We don't customize things, but we do a lot of things that a lot of doctor wants to do. So for example, if 50 doctor comes and say they want this feature, we'll build that. But even if a non-doctor comes and say, build it for me, I'll give you 2 lakh rupees, I'll not build that feature. So we build for large usage cases so that it can impact a lot of people. So these are the fundamental things we are building on. There are a few features which we have built which really help doctors in terms of help make that clinic larger. Right today, for a lot of doctors, Dr. Sanjana said, when you start the practice, then clinic is only dependent on doctor as a point of sale, point of service, but it needs to be a lot more. Like how can the ancillary services help build practices? Which means how can ancillary service one get a lot of repeat customers? Second, how can make it easier for the staff so that you don't have to you get more helping it. Third, how can it makes me extra money? Lot of things generates out of your clinic. Whole pharmaceutical company, 70% of their business starts from doctor's clinic. Why can't we be facilitating those transactions? Whole labs, 80% of their business starts from doctor's clinic. Why can't all of us participate in that? And many more reasons. So I have my partners, Bhaskar and Mohit, explaining few of these cases which we built. I am here on the call, happy to answer. Please put your question in the chat. I will be really happy to answer some of the questions. Hope you enjoy this session and learn from something from it, and we'll have a mutual future partnership. Thank you very much.
Thank you, Deepak sir, for touching upon, I think, the main ethos by which Eka is built and how doctors are the center stage. I think myself being a doctor, I would just like to add that we are always taught through our medical education how to be the best doctor. But I think building a clinic needs that extra, dash of business acumen, and that's where I'm hoping this webinar will really help for the doctors who have joined us today. So without just another thing, if anyone wants to interact and have questions for our experts on the panel, you can please post your questions in the Q&A. We will address it either at the end of individual sessions or at the at the very end of the webinar. So without wasting more time, we'll just move to our next speaker. We have Mohit sir, who will be talking to us today. Just a brief intro about him. He is being the head of commerce, business, and founding member at Eka Care. He's had over 15 years of experience in orchestrating and building brand management, customer acquisition in travel and e-commerce, travel technology, and now health tech. And today in the webinar, he'll be talking to us about a unique model called Health Exchange that has been built by Eka to address the same thing, unlocking earning opportunities for doctors. And just another thing that I'd like to add is digitization is We always see it as just building an EMR, but only once that's like the foundational thing before we do and get other advantages of digitization. And this is exactly that. So I'll let Mohit sir take the stage now. Mohit sir, over to you.
Yeah, thank you, Dr. Salma. Hello, everyone. My name is Mohit. And so today I'm carrying one presentation. So the idea is to run you with a small presentation on the monetization opportunities, right? So, like Deepak also said that yes, there are no free lunches, etc. But as an organization, what we believe in giving the right value for our users, right? So eventually, when you pass the right value, then definitely the end customer is ready to pay, etc. So I'll share my screen, and then we start. To start with, as a doctor-centric organization, the first step is that we want to make every clinic as a smart clinic, and we want to make doctor clinic as a point of sale where we enable them for a commerce, right? So that's the first initiative we want because, example, when I go to a doctor and when he is a digital doctor, not writing on a pen and paper, there is a digital prescription coming on to me. Similarly, appointment is digitized, then I'm getting reminders, etc. Similarly, there are other opportunities also at the clinic which we unlock for a clinic, right, which I will cover. So what we do here, we make the clinics as smart clinics, and we also enable clinics to earn up to 7 lakh rupees a year. And how does it happen? So we have some proposition. The first proposition comes as Eka Health Pass. So eventually, what we are doing, each proposition I will explain it in another slide. But Eka Health Pass, what it brings to the table for a doctor, it brings the repeat patient. So eventually, a patient who is buying a health pass for a doctor, it would come that okay, the repeat count is growing. That's one of the fundamental things for any business. Similarly, we also enable clinics for e-labs. So this offers a choice of selection for the doctor for the patient, sorry, and also bring transparency for the doctors. Medicines, we have a reliable partner called 1mg, in which we bang on like what you see is what you get. How it works, I'll explain you. And on the other side, we have another module called DHIS, which is this is an initiative run by Indian government to ensure that yes, every facility is digitizing the records, and then over and above there are an incentive which are being passed by the government. That only happens if you join a hand with any ABM compliant partner, which ECA is. Moving to my next slide. So again, like the first proposition was Health Pass. So this proposition for a patient is cost, it's 4,999 per year. Basically, as a user, if I pay only 5,000 per year, what I unlock, this pass enables me to get my 4 family members, 2 adults and 2 child. In return, what a patient is getting, a 30% consultation off on the doctor. So let's say if I go to Dr. Bhaskar, I get 30% off on every consultation. In return, ECA pays fully to the doctor, but there is a value for the patient. Similar way, 25% off on medicine. And if you see that 2 free body health checkup worth rupees 4,800 rupees. So eventually, as a consumer, if I'm buying this pass from a doctor's clinic, I am unlocking a value of 25,000 rupees per year. In return, what doctor gets it? Doctor gets straight away 2,000 rupees for that patient. And plus, since we want to make clinic as a point of sales, the staff plays a major role. So here the expectation is that staff who is at the clinic is just nudging the patient if he is looking for any health pass, and in which we also incentivize staff. So if you look at on a per patient, the doctor is getting 2,300 rupees as a facilitation fee straight away. And yes, there is a value for the patient. If you look at teleconsultation, so I call it as a concierge service, right? So doctor clinics shuts at 9:30. And after that, if I'm a past user and I want to connect with a doctor, I have an opportunity to do a teleconsultation. So it's like an emergency service running 24/7 for the past user. So eventually what I would say, because I have bought health pass from Bhaskar's clinic, it enables me to get all these services, right? So again, it's a win-win situation for a doctor and a patient. And on the other side, what we are bringing a convenience for the patient. And yes, on the other side, it is making a doctor's clinic as a smart clinic. कि मेरा clinic पूरा digitized ढंग से हो गया. This is the another proposition which is e-labs. So we help in facilitating in activating e-labs for the clinic. So pretty simple. What it brings on the table for a doctor and patient. For a patient, it brings choice of selection. So today, booking a lab test is a problem. Like if I go to any clinic and somebody writes a test for me, as a patient, I have to find out like which partner I should go to. Who is the lab partner? Similarly, if it gets facilitated through clinic, it brings a lot of convenience for me as a patient, right? And on the other side, what we are bringing choice of selection. So as a consumer, I can see that, okay, these are the 4 labs available, this is the price, and then the staff can book it from then and there. And what it brings for a doctor, it brings transparency. Today, when any lab test is getting facilitated from your clinic, you have no visibility where the patient is going. While yes, there are some monetization benefits with the lab is passing, but you don't know whether it's right or not. What our system brings, and our system brings transparency and the report back to your on the doctor too. So I know where my patient has gone, the lab test is done. Once the lab report is done, it gets uploaded back to the doctor too. So doctor know that, okay, this was the patient, the lab package was done, and this is the report. So patient and doctor both gets the report too. So again, we are connecting the whole ecosystem there. This is the structure. So eventually, on every lab transaction, we pass a facilitation fees. So we categorize that, okay, when the test happens, whether it will be a routine test, specialized test, regulated, or a packages, in which we pass 40% on routine tests, which will be passed to the doctor as a facilitation fees, and 50% on packages. And it varies on, lab to lab. And specialized and regulated is as per actual, that everyone is aware of. Again, if I talk about on the partners, so again, we work with all NABL labs. So we have Metropolis, who is known in the industry for last 35 years. So I would say is the reliability, right? On the other side, we also have affordable partners called Redcliffe, and Newberg is again known for the reliability side. If you're looking for again experience front, we have Orange Labs. So Orange is known for the fastest delivery and the better experience. So these are the all combined labs we have, which is again shown to the consumer before buying, and all are NABL labs. Then we have pharmacy. Like I said earlier, that the partnership with Tata 1mg, we are pretty clear that yes, what is the value we are bringing on the table is what you see is what you get. So what is important for a doctor is that, okay, if one medicine is not available, the tool should prompt so that the substitute is given. We don't want that, someone is standing at the pharmacy shop and then calling, doctor sahab, ye wala dawai nahi mil raha, kuch aur mil jaye. So what we are ensuring that, okay, the doctor who are using our doctor tool, writing a medicine, would ensure that, okay, if the one medicine is not available at a dark store, then, substitute is being given. So that's why, we are calling that what you see is what you get. So your patient would get the branded medicine prescribed by you. And in case any medicine is not available, the system will prompt that, okay, this is not available, you can get the substitute. And again, for that, we have, facilitation fees we want to pass. So this is like, we pass 18% pool to the doctors, in which 15% is passed to the patient and 3% as a facilitation fees to the doctors. This is our, I would say icing on the cake, the THIS scheme. So what is the example we are taking that, okay, if a doctor who is seeing an OPD of 100 patients a month, we guarantee that, okay, he will earn 8,000 rupees per month from this scheme for sure. Our team will facilitate all the requirements is needed to do this, but we that's the reason we have marked it also that, okay, once somebody buys our complete suit, it's a money back guarantee. If he doesn't earn 8,000 rupees, we would refund that money back. In which what we ensure, basically what we ensure from the doctor side is he should have a minimum 100 patients, which he should see. Basically, a valid 100 prescriptions should be written to make 8,000 rupees as a flat facilitation fees for him. This is the another one more slide to combine everything. So, like I was showing under the smart, under Health Exchange as a smart clinic initiative, there are 4 propositions, right? We have health pass, we have lab, pharmacy, and DHIS. So we have taken an example that, okay, if a doctor writing 100 valid prescriptions, basically which gets qualified in which, there is a pharmacy, lab, everything is there. How much, money can be unlocked for one clinic? So eventually, if 100 prescription are written, we have to assume that, okay, 30 lab tests, 50 medicine orders, and then yes, DHIS is as such, if somebody sees 100 patients, the doctor unlocks 8,000 rupees, and then we are also expecting that at least 15 patients would also buy a health pass. So eventually, all put together, a clinic can easily unlock a 60,000 rupees earning per month. This only happens when, when you take a EGA suite in which you can write a digital prescription to manage all your appointments, reminders, and do all the commerce activities. This all happens in a single tool. So you don't have to go here and there. This is happening in a one tech itself. And if you look at that, what is coming, what is the cost of this? These are the plans we have, right? We have a Pro plan, Pro plus, and then we also have a iPad module. And not only this, if let's say any clinic has 4 or 5 doctors, we also have a front desk module available with us. So I think for all plans, please reach out to us. The team will be happy to guide. And by taking this suit, we definitely guarantee on the DHIS front, and plus also enable your clinic for all the monetization activities like pharmacy, labs, and help us. Not only this, apart from that, once the clinic is activated, we also, facilitate all the branding activities in the clinic, and these are some samples which we would deploy once the clinic is activated. So that's it. Thank you so much. Open for the Q&A, if any, or otherwise, Dr. Sanchana, over to you. We will take it at the end of the session.
Yes, Mohit, so actually, there have been a couple of questions during your session. As I read out about it, Dr. Bobby Devan.
Yes, good evening.
Doctor, thank you for joining us. Please.
Yeah, thank you. So my question is that when you write a prescription for a patient and Tata 1mg is going to deliver it to their house, is there going to be a minimum amount of, the amount that has to be spent in order for them to deliver the medicines?
Yeah.
Mohit,
I can take that question. See, like any other e-commerce delivery, if there is the order which is low value, there will be delivery fees. If the value is higher, then there will be no delivery fees. Practically, that's how e-commerce models or how the delivery model work. You can order for 10 rupee drug, or you can order for 10,000 rupee drug. Well, delivery charges will depend on ticket size. For example, normally if the ticket size is more than 500 rupees, there are no delivery charges. But if it's less than that, it will be 20 to 30 rupees delivery charge. In certain cities, now ManMG is also delivering within 2 hours. In city like Gurgaon, Bangalore, Bombay. So they're delivering in 2 hours. And for the first 6 months, there is no express delivery charges for express delivery. But if the ticket is high, then general delivery is free.
So my another question is that as soon as I write the prescription, will that prescription directly go to Tata 1mg, or I will have to send it to them, or does the patient have to share the prescription? How would they know?
Yeah. So as soon as you write the prescription, and then you have an ability to order that prescription from your clinic. So you or your staff can press one button, saying, okay, I want to order, because it's not that you have to order for everyone, and we don't want to pass all the patient information, not to us, not to 1mg. Information which is only for transacting customer will move, wherein if the patient is agreed, then you can just simply click, and then it's all seamless. One more click and it's all seamless. You can enter the address and it will get delivered to the patient directly. You can do COD, or you can collect into the clinic, or patient can go into Care app and pay and do the same process. But there needs to be one more click. Not that every prescription will go, because not that every patient would want to buy from you, or you want to pass all the information back to us for energy.
Yeah, so these days we do online consults, and sometimes we're sitting in Delhi and we have a patient somewhere else. So will this still be applicable there too?
Yeah, this is a beautiful solution. Even both this and lab are beautiful solution for teleconsultation only. You could be in Delhi and your patient could be in Ahmedabad. It'll work seamlessly. It's pan India, doesn't matter.
Great. Thank you. Thank you. Thank you.
Thank you for the question, sir. Actually, if you want to see exactly how this happens, we have the live demo of the tool itself, like
Yeah.
how this flow works. Right from creating the prescription to placing the order, be it the medicines or the lab. And just in addition to a question which was asked in the Q&A, they had asked if can the medicines get delivered in tier 3 town. I have a lot of patients connecting over teleconsultation from remote places. Maybe, sir, you can talk a little about the penetration of the ECA services in this case.
Yeah, I think
When-
tier 2, tier 3 towns are covered. There could be some towns where delivery could be slightly late, which is like happens in 2 days, but majority of the towns are covered.
Yeah.
And at the time of placing, you would know. Like for example, I'm placing today for a place called Karnal in Haryana. I would get to know how much time will it take, what's the expected delivery time right before ordering. So patient or doctor staff can take a cautious call before placing the order.
We'll have one more question. I think there's one more person who raised their hand before we move to Bhaskar sir's session. Can we, allow Dr. Bharat Raj to
Well, actually, I'm
have
current plan like ECAP Pro, I think. So if I need to integrate the pharmacy, what should I do? What will I have to upgrade the plan, or will it be fine with this current plan I'm using?
You want to integrate 1 mg in pharmacy, correct?
Yeah, yes, sir.
You don't have to do anything. You don't have to pay anything.
Okay.
Just we will do it for you.
See, actually, I'm in Tier 3 city and there's no labs, NABL labs available. Even it is available, it is integrated with those hospital. So what would be the right solution for me? Like,
Which city are you in, sir?
I'm in Tamil Nadu, the town called Rajapalayam.
Raja. Do you have RT lab or Metropolis available in your area?
RT lab is there.
Yeah. So we're coming up with RT, next week.
Sure. Thank you.
We have RT available on our platform next week. We have Metropolis. What I heard from Newburgh also, they're very popular. Their market share towards Chennai is also very high, Metropolis. So please check if Metropolis is already live, but RT is coming next week.
Sure. Thank you. Thanks a lot.
I think after the webinar, we'll probably, someone from our team can connect with you and give you a demo. We'll be having a group demo at post the webinar anyway, so you can attend that as well for more clarity.
Yeah.
So now I know there are a lot of questions, but we want to finish putting all our opportunities on the table. So I'll just move to the next talk by our very own Bhaskar sir. He is the head of product and obviously a founding member at Eka Care with over more than 17 years of experience in the industry with building the products and growth initiatives across travel and e-commerce. Sir is now been in health tech again for the past 4 years and almost been the pillar behind every product that has come out of Eka Care, be it on the doctor or the patient side. And just like I'd like to add that we've hit that 10 million milestone also last week. So over to you, sir. To talk more about the opportunities that doctors can unlock.
Sure. Thanks, Dr. Sajna. Welcome, everyone. So what I will do is, I'll just continue on the whole suite that Mohit showed to you, and I'll go deeper on certain modern revenue engagements which are coming up, especially post-COVID. Let me share my screen. Let me know once it is visible to everyone. So, effectively, what has happened is post-COVID, the whole OPD plus IBD cover is seeing a strong surge. People who are interested in effectively taking them. And there are some very important reasons. One is, if you see, why say if a retail inflation is at say 7-8%, medical inflation is at 14%, which means that effectively cost of common ailments, where there is a hospitalization that is required, has more or less doubled. So now people have experienced that during COVID, and people also what they have experienced that when a hospitalization happens or when there is any treatment that is meted out. So effectively 70% of cost that is incurred in health is across OPD. So while post-COVID people realize that hospitalization is a massive cost and one should safeguard, and that's why insurance, health specifically are gaining ground. But people also realize that while hospitalization is cashless, there has to be a mechanism where even OPD has to be cashless because that's where 70% of cost is incurred. So effectively, what is happening in the industry right now? There is a massive tailwind of digitization. You all have heard about EPDM. You all have seen how government initiatives in finance and otherwise is focusing on digitization. Whether it is fintech, whether it is travel, you have seen Digiyatra. So every sector is effectively, India has realized that as a world leader, we have to basically put out these strong stacks which will help increase digitization. And digitization effectively does nothing but it helps create opportunity. Then it should, while the opportunities could be outcome-based, there are interesting revenue mechanisms. And doctors are at the center of any revolution that has to be successful as far as health is concerned. So if you see with this trend, the need of the hour for insurance and patients is trusted network of doctors and clinical outcomes on OPD that helps in reducing hospitalization expense. So these are two very important areas. Now, if I go further, effectively, a clinical outcome cannot happen without participation and blessings of doctors. Now, how does that happen? Effectively, it's a three-way model where doctors take care and how EGA helps them is effectively EGA is having an EMR which helps generate longitudinal patient context. And we are not a transactional marketplace or a services layer like Deepak mentioned. We don't get into models where effectively you have a listing place or those sort of capabilities. Effectively, we want software or we build software that helps doctors enhance their relationship with patient and helps them deliver good care. Also, the other part that is gaining ground, like I said, is OPD subscriptions. What we are referring to when we say OPD subscriptions is that how can a subscription make access to healthcare affordable, make doctor-patient connect strong, and help improve health outcomes for the ultimate hospitalization expense. And the value add that happens by ECA there is that effectively as things digitize, as these tools gain popularity among doctors, there are these well-informed contextual patient cohorts that start forming up which makes it easier for insights into forecasting health outcomes. And if you're able to do interesting health outcome forecasts, hospitalization expenses will go down. To give you an example, uh, effectively in 80s or even early 90s, India was a capital more in terms of communicable diseases. Come 2024, and if you take this decade, India is a capital of lifestyle diseases. So this transition will happen in just 30 years. The treatment, the infrastructure, the capabilities for having set up for communicable is very different. Having set up for lifestyle is very different. So when you understand the patient cohort, you are able to make out solutions accordingly. To give you an example, today, if someone is insulin type 1 diabetic, getting an insurance is next to impossible. But now there are ways where even a type 1 diabetic can get an insurance, but then there has to be blessings and there has to be some data trail that has to be generated by a doctor, which helps an insurance or a subscription company take informed selection when effectively rolling out distribution of OPD. Similarly, when these things come together, a doctor who is keen on uplifting their stature and getting closer to their patients, and then there are subscriptions which makes quality care approachable, that prices they automatically become affordable, and that's what the value add is from ECA, which ultimately is helping in creation of shareable health profiles, not only for family, but also for say providers and payers. So now when you see this whole trend, when you see how digitization is gaining ground, Mohit already showed this slide. Now this is why say a company like Eka Care is able to bring out a solution like say Eka Health Pass at a rupees 499, where what I want is that instead of going to Facebook, going to Instagram, going to any other channel or even in agent, my interest or my areas is effectively my relationship with doctors. And instead of paying any money anywhere else, I will pay 2,000 per pass as the health outcome fees to my doctors, where effectively a patient's lifetime value, if I only talk commercially, a patient's lifetime value worth incentive is given in one transaction. And then the patient is also getting a lot of value. There's a 2 free advanced full body checkup. Now, there are health camps, there are 20 other things that are being done just to get some signal to get more treatment. We are giving a 2 free advanced full body checkup by taking 499 after paying out the 2,000 rupees health outcome fees to doctors, which makes a patient go back to the same doctors again and again when you are effectively the point of sale. Not only that, we facilitate medicine orders, we facilitate health packages, we facilitate a pass where people can bring their whole family. And of course, when I talk about 2000 initially, because we are building this market, We want to have early set of doctors who will work closer with us, who will help us improve. And there are a lot of other areas also. If you go to our app for users who have effectively given 4999, if you see post-COVID, areas like lifestyle, areas like mental, areas like stress, areas like anxiety are picking up. We have very interesting capabilities. For example, people can take their heart rate just using smartphone. They don't need a watch. So the value is very clear, value can be given. I'll not touch upon concierge, Mohit has already touched upon that. But these are modern revenue initiatives. These were not available, say, even 2 years, 3 years back. But now it is possible. Why? Because there is a digital trail and there is a certain digital adoption that we are seeing across doctors. Similarly, another solution, thanks to our partner Care, and there are many more, but the thing that you are seeing on screen is coming from Care Health Insurance to Eka Care, is a insurance which starts at rupees 590 per month. And here, on every sale of an insurance, the health outcome fees of rupees 3,500 is paid to a clinic, and even a staff incentive is being paid out. And what does a patient get? Almost 50% off on a consultation, 25% off on a medicine order, up to 16,000 worth of medicines. There are these standard lab tests and packages, and of course, things like access to premium app features, things like teleconsultations. So all these are also available. Not only this, we have started working with a lot of companies pan India, big insurance providers, standalone health insurers, corporates, where what we are telling them is that there are doctors who have digitized their practice, they are available, they are reachable, they are bookable, they generate digital RX. They will give you a digital context of patient medical view, which will help you get aggregate medical outcomes much better. And they say that we are more than happy to work with these doctors. Now, these are very, very clear, respected demand, where we are not a marketplace where we are saying that, okay, my next doctor is not available, so why you don't you book from one doctor? Why? This is more about search capabilities, partnership capabilities, where all you need to do is have a rich profile on Eka, have a clear, readable profile on Eka, make your visiting hours available, make your location proper, get a public number which is there for anyone to reach out, and you will start seeing bookings coming in as we enable these partnerships. You will always do this thing. Update your profile, you will get your score, you will see thanks to the whole 10 million app installs and things that we have worked on COVID, on ABDM and a lot of other government engagements. I don't know if you folks are aware, but our CEO Vikal was the one who built out Arogya Setu and gave government with very strong data practices. He won a president's medal for that. So that tells you the level of commitment coming from travel to health that we have. And with these opportunities, you will get visibility and you will also get patients in a very, very new, novel ways. And I wanted to touch upon insurance and OPD specifically. Probably we'll be doing demos. Already you have seen traditional models like, say, medicine lab, but this will also be combined and this will be something where you can roll out to patients. And trust me, people buy these sort of things from people who they trust. That's why the whole agency, that's why you will see in your relative, there will be someone who will be an LIC agent or something, but they will be doing well. Patients trust doctor more than anyone else. Patients trust doctors sometimes more than their family when it comes to health. And that is why we believe that when these products are rolled out from your clinics, again, you're not a seller, but you folks are the influencer, you folks are the ones who take these digital revenue mechanisms up. And we just provide these platforms for you to basically engage and take them forward. So these things is what will be coming soon. Effectively, the last one, insurance is already live. Probably we can reach out, like Ajitesh mentioned, you can see the demo and reach out, and we will enable this. We'll enable these facilitations. There are a lot of marketing, branding engagements also that comes with them. That's how you effectively make your clinic smart clinic, and that is what I wanted to close it from my side. Over to you, Dr. Sajja.
Thank you, Bhaskar sir. I think you put across very clearly how, doctors are at the central point of trust and, the journey of a patient's health and wellness overall. Just if there are more questions, I think because there were quite a few doctors who had raised their hands, we'll go to the Q&A and then, discuss other questions which came in the Q&A. Just sharing the poll results for the audience also to understand how the ecosystem is in general when it comes to running their own private practice. Meanwhile, Rahul or Nisha, can you unmute Dr. Hukum Singh, sir? So as we can see, usually, where we ask where would you usually prefer to use the extra revenue generated, majority want to expand their clinic, followed by spend it on marketing. Then the tie-up, I think, which we kind of discussed till now is, do you have a tie-up with your local pharmacy and a diagnostic center? Majority do not have one. And I think this is where it helps to, come into association with care kind of models with health exchange. And then do you feel there is transparency? Again, majority, I think it's a little, it's a 50-50 where half of them are okay with the transparency that they're getting from their pharmacies. And the last question was, how do you offset your extra expenses? I think it's a tie between local partnerships and an in-house pharmacy. Now over to Dr. Hukum, sir. Hi, sir. Welcome to our webinar. Can you just share your thoughts and questions that you had? Hello.
No, actually, I'm really a naturopathy doctor, but in your lab, there is no naturopathy also over there.
Hello.
Hello.
Yes, sir. We couldn't hear your questions.
Actually, I am Ayurveda and naturopathy doctor, but
Okay.
in the ABA, there is no naturopathy option over there.
No, sir.
And
I
we
think
get registered in ABA.
it's a part of the DHI scheme. Like I think Mohit sir or Bhaskar sir can expand on it more.
Sure, sure. So let us take this query. Dr. Hukum, give us some time. We'll take your query and we'll check with the APA portal folks from government itself if there is. I'm sure there will be this option. We just have to see which category that will be there. So we will check this and then someone from the team will revert for sure to you.
Okay, thank you, thank you.
Thank you, sir. There is another question by Dr. Monil. He's saying he's been using Tatva Care as his EMR platform and wants to know how Eka is different from Tatva Care.
Okay, I'll take that. See, first thing I would say, it's not great to compare two products. They're very, very different products. We should respect every company, and we do respect whatever Tatva Care is building. But I can talk about Eka Care and how we're different from any other EMR in the market. I have seen many technology companies over here, and I keep seeing technology companies. As I said, I'm part of this ecosystem since it started in India. So a lot of company comes and talk to me. I have not seen any technology which is as reliable, as good as ours. And I can, put all my life experience behind that. And it's not, I'm saying because I'm doing it. If you would have asked this question maybe a year and a half or 2 years back, I would have said we're still building it. But today, I don't see any solution which is as comprehensive, as reliable as ours. And we've been seeing this for every day. And we're very, very passionate about this. There are many, many companies. You'll see a lot of local EMR companies like Tatva Care, etc., who are trying to do something similar. But the baseline technology used by these companies are not as reliable, and the user experience is not as good as ours. We work on, our solution works on anything which is mobile, iPad, desktop, laptop. You can have a clinic management solution, etc. So these are basic EMR. I'm just talking about writing prescription would be far easier for your eyes because you have to use it every day, for 8-10 hours than any other EMR solution. So that's one of the biggest advantage for using, because at the end of the day, you as a doctor need to use this like 6, 10, 8 hours a day. It needs to be much more pleasant than doing mundane job of data entry. The second piece is the services which we just talked about. For example, having an e-lab or having an insurance and enhancing your practice. It's not being offered by anyone else in the market, right? The way we are doing connectivity. And why are we able to build all this connected, right? When there was this question, how will my prescription go to 1 mg? It is not an easy task. When you type on Eka Care, same thing going to 1 mg and getting it delivered is a very, very tough problem to be solved through technology. For human eyes, it's easy. For technology, it's a very hard problem. You ask your EMR provider, can they do this? If you ask them simple question, it's just not possible. We spent good 1 year in building all this stuff with all the kind of data science, AI, etc., putting behind it to build all this. So we've invested heavy money behind building versus companies who are doing it, to sell their pharmacy. So I would say you can compare anything. We have to really compare Eka Care, compare with systems like Epic in US. We don't see real competition in India. So I'll not be like to compare ourselves with any EMR company in India. You need to be compared with the global player. We're building that standard. We will use line code. And then there was a question, right? How would you the substitute would be, how can we trust that substitute, right? That question. Because it's all technology. When you understand the composition of that drug and what are the same composition, because there are different brand names being prescribed. That's why we have built a whole library and engine of our own based on AI to kind of build all this. So we have invested a lot. So a simple example, go to EkaCare app as a patient, upload a medical report, and you will see the magic of how that report comes into a graph. And ask other companies to do it. You'll find it hard. It is not a problem which has been solved by large companies. So companies like Google, Samsung, Apple are talking to us to utilize the services for their consumers, which means we have built something great, right? These large companies are tech giants. They have energy to build around technology. So we build all those stuff, which is why I would not really like to be compared with any Indian EMR company. If you ask me about Epic, then we can debate, but not Indian EMR companies. Thank you.
I hope that answered your question, sir.
Yeah.
Just to add on to Dr. Akshay's question. So there was a question on Q&A asking how can I trust the system's recommendation for substitute medicine? So as the doctor on the panel, just to give a little insight to the other doctors that this is keeping a fundamental rule that if you as a doctor have prescribed a certain generic or composition, the substitute which is recommended will be always something which has exactly the same generic with probably a different brand. And again, this will not be automatically sent to a patient. You as the doctor need to, okay it and say, I'm okay with this substitute being sold for the patient. So that double or triple validation is always set in the flow, which you'll again see in the live demo as well. Then there's another doctor who's raised their hand. I think Dr. Vishal Goel. Hi, sir. I think you can unmute yourself to interact.
Hi. Actually, I wanted to ask a question like in the your patient pass plan and the insurance plan, you will be giving discount to the patients on OPDs and other things. But what about the payment to the doctors? Like, will there be an incentive cut for the doctors also?
I'll again take that question. So, the mathematics is done very, very, again, as I said, in favor of how can we add value more to doctor clinic than to EkaCare. Doctor consultation, there is no deduction. So whether patient comes once, twice, 5 times, you'll get full consultation fees every time. There are some ancillary revenues which you make. All those has been compensated at the time of purchase. For an example, if 5,000 rupee purchase happens, your friend gets about 2,000 rupees as a clinic for facilitating the transaction, which covers, generally, and all of you can calculate. If a patient comes to you, can you make 2,000 rupees from that patient in a year beyond your consultation fees? When I asked this question to a lot of doctors, the answer was, it's not even 500 to 1,000 rupees per patient in a year from ancillary service, not from consultation. Consultation, as I said, we are paying fully. So if that patient comes 4 times, you get full consultation 4 times. Ancillary, you will not get anything because we are just giving that value back to the consumer, otherwise consumer will not buy. But upfront, that value is coming. So as if you look at IPD insurance, that product would be about a 30,000 rupee product. In that product, the income will be in range of 4 to 5,000 rupees. That 4 to 5,000 rupees making from a patient in 2 years is also a very, very hard problem beyond the consultation. And because the trust is there, patient will keep coming back. Your repeats will increase. We tried this experiment in city called Indore. Repeat footfall for doctors increased drastically. And they enjoyed the benefit of cross-selling from the clinic, like you cross-selling with the product.
Okay, and another question I would like to ask is like, see, before in the starting, when the Eka team came up to me, I was not planning my own setup, but it was in the process. So they gave me a demo, they made my profile. At that time, there was no charge. But because I had not opened my setup, I was not able to use it and experience it. Now, now they are all chargeable things. But how would I know if I'm going to enjoy the product or like I'm going to like it and pay the minimum amount is 10,000, I guess. So there are things like I am a new setup owner, and already we are bounded by maintenance costs. That is always goes a lot. You guys have experiences on that. But how we can spare about another 10,000 just to get to know that if we are going to enjoy the product or not.
See, we have lot of doctors using it. So hopefully, I don't know about your practice, but you have patient you will enjoy. You take out this cost very soon. And this question has been asked by a lot of doctors. And like any startup, when we were building, as I said, if you would have asked me this question a year and a half back, I would have said I'll give you free. Use it for a year. But unfortunately, that's not the reality, and I can't keep my company going without making money, right? We also have to start charging, and that time has started. Initially, everyone gives free because we were building learning from doctors. Now we have a solution which we believe is the best in the country. If you have to ever use an EMR, I don't think you'll find better than that. So if you're starting a practice, it's better to always have a data at digitally. You can access it anywhere. So trust us on that. You will never find any solution better than this. If you're able to show that, I'll personally return the money. That's what I can say. But beyond that, the opportunities we are giving you, you would see that by paying 10,000, you're actually making money in a year. And that we have seen for not one, we have seen for hundreds of doctors, hundreds of them. So if you work the way team is paying, kind of keep guiding you how to work on it, you will see additional income equivalent of what you're paid every month or more. I have doctors who are making 2.5 lakh rupees. Their practice is old. They have a lot of patients coming in. So they're making 2.5 lakh rupees, 3 lakh rupees every month from us. So there are hundreds of doctors trusting us. What I can say right now is trust us. If you still file, you could reach out to me personally. I'll be happy to understand why you're still not happy with our system. But I have full confidence that you will enjoy working with us.
Okay, thanks for that. I would like to know more about the lab system. So hopefully get your team to contact me later on for that.
Sure. So we'll have someone from our team reaching out to you. Which city are you in, sir?
Surat, Gujarat.
Surat, we have a lot of doctors. Great. So we'll have someone reaching out to you very soon.
Okay, thank you.
Thank you, sir. I think we have one more question we'll take. We have Dr. Ashish who's raised their hand.
Hello, can you hear me, please?
Yes, sir. We can hear you.
Okay, I'm from Gurgaon. I just wanted to know what are the labs that you have tie up with in Gurgaon?
Sir, I am also from Gurgaon, so great to catch up. We have Metropolis, Redcliffe, we have Orange. Now, SRS partner is just the integration going on. We also are. We have Newburgh. So all of this labs covers almost all the tests. We also do a lot of work with functional medicine doctors. So we have all their tests as well available through a couple of more labs.
Oh, wonderful. If you already have things with functional medicine, I would really like to, connect with you. Since you are in Gurgaon, I would love to meet you. There are so many aspects that we can discuss, like differential diagnosis. There could be many tools that I could help you build also.
Sure. Which area are you in?
I'm in Greenwood City.
Oh, you're in good. I'm on Golf Course Road. So
Also, it's only 5 minutes away, 10 minutes away.
Yeah. So I'll reach out to you. I'll fix up some time with you.
Sure, wonderful. It'll be a pleasure.
Yeah. Thank you, Dr. Ashish.
Thanks.
Thank you, sir. I think if we've answered majority of the questions, there's one last question. Bhaskar sir, maybe you can pitch in. This one asking, I'm a pediatrician who is starting my practice. Which plan of yours would be the right one for me? I'm a pediatrician and this is Dr. Anand Singh. I'm a pediatrician and want to open a clinic in upcoming 2 to 3 months in Noida. Which plan is best for me, which will help me in building my clinic?
Sure. So my session will be to
Talk on this.
yeah. So just to tell you, we have a good iPad plan, and very shortly we are about to ship the whole vaccination reminders, which is important for your practice and even growth chart. So we are working on that. But while you create prescription and the revenue monetization that you saw, the Pro EMR plan, I think you should evaluate and then see. And like I said, disclaimer, the vaccination piece and the growth chart is being developed, should be there probably in a quarter's time.
Dr. Anand, sir, I hope that answers your question. If not, you can, we'll be sharing our, support team's number in the chat. You can reach out to any of us anytime. So I think we close the official webinar now. So any last, thoughts from any of the panelists, I welcome you to share it. Otherwise, then we move on to the live demo by Imtiaz.
I'll just take 1 minute, especially on one question that how will I increase the footfall in my clinic? So I'll take a minute to address this. So we are not a marketplace where we commit patients that, okay, we would start passing a new patients to any doctor. But what our technology does, we have a complete suite which enables a clinic to become smart, in which you can manage your appointments, digital RX, and again, the integration with WhatsApp and all the monetization tools. So eventually what you are doing, you are improving your patient experience. And we all know if the experience is improved, you would see that, the repeat patients are coming to you. And plus, since we are also an official partner of Google, we also help in setting up your Google My Business and along with the reviews. So similar way, you have a right technology, the patient is coming to you and, if staff is also getting the review, which will go to your Google My Business. So eventually it spread the words. And when the word is spread, then eventually your, practice improves. So that's what I just wanted to add on. Thank you.
Absolutely right, Mohit sir. So again, I would like to thank everyone, all the panelists who have joined us today and the attendees. We will be continuing these webinars. So if you would like more updates on what's happening in this ecosystem, you should join our WhatsApp community.